Phlebotomy, the practice of drawing blood from a vein, is a cornerstone of modern medicine. It's a vital part of diagnosing and monitoring a wide range of medical conditions. From routine checkups to complex treatments, accurate blood analysis provides crucial insights into a patient's health. This essay aims to guide you through the intricacies of phlebotomy, highlighting its importance and outlining the correct procedure for obtaining a blood sample. Imagine a doctor trying to solve a medical mystery. Blood tests act like clues, revealing vital information about a patient's inner workings. They help doctors check cholesterol levels, monitor blood sugar in diabetics, track infections, and much more. Without phlebotomy, many diagnoses would be delayed or impossible. This essential procedure is performed by skilled professionals called phlebotomists. They are trained to collect blood samples safely and efficiently, ensuring patient comfort throughout the process. Before we proceed to the step-by-step guide, let's familiarize ourselves with the instruments used in phlebotomy. The primary tool is the syringe, a simple yet ingenious device designed to draw and dispense liquids. It consists of a barrel, a plunger, and a needle. The barrel, a hollow cylinder with markings indicating volume, holds the blood drawn from the vein. The plunger, a rod that fits snugly inside the barrel, is used to create pressure for drawing or pushing fluid. The needle, attached to the barrel's tip, pierces the skin and vein to access the bloodstream. The needle itself comprises several parts: the hub, shaft, bevel, and lumen. The hub connects the needle to the syringe. The shaft is the long, thin metal part. The bevel, a slanted tip at the needle's end, facilitates smooth entry into the vein. The lumen is the hollow space within the needle through which blood flows. Understanding these components is crucial for safe and effective phlebotomy. Proper preparation is key to a smooth and successful phlebotomy procedure. Before you begin, gather all the necessary materials. These include sterile gloves to maintain a sterile field and protect both the phlebotomist and the patient, 70% alcohol swabs for disinfecting the puncture site, cotton wool to apply pressure after needle removal, syringes and needles of appropriate sizes, chosen based on the amount of blood needed and the patient's vein size, a tourniquet to make the vein more prominent and accessible, blood collection tubes color-coded to indicate the specific tests required, gauze pads for additional pressure and dressing the puncture site, a sharps container for safe disposal of used needles, disposable lancets used for finger prick blood tests, phlebotomy plaster or adhesive bandages to cover the puncture site after blood collection. Having all the materials readily available ensures a streamlined procedure with minimal discomfort for the patient. Now that we're familiar with the tools and supplies, let's walk through the phlebotomy procedure step by step. 1. Confirm patient details. Before starting, always double-check the patient's identity using two identifiers, such as name and date of birth. Verify the test requested and ensure you have the correct blood collection tubes to identify the test. Different tests require specific blood collection tubes, so confirm the requested tests and gather the appropriate tubes. 3. Assemble materials. Prepare your work area by laying out all the necessary materials within easy reach. 4. Examine arms. Ask the patient which arm they prefer. Inspect both arms for suitable veins, looking for ones that are prominent and easily palpable. 5. Disinfect the area. Clean the intended puncture site with a 70% alcohol swab using a circular motion, moving from the center outward. Allow the area to air dry completely. 6. Apply the tourniquet. Apply the tourniquet about 3 to 4 inches above the puncture site. Ensure it's snug but not too tight. The vein should be visible but not overly distended. 7. Draw blood. With the bevel facing up, insert the needle into the vein at a 15 to 30 degree angle. Once blood appears in the needle hub, gently pull back on the plunger to draw the required amount of blood into the syringe. 8. Dispose of the sample. Carefully remove the needle from the vein and immediately engage the safety device. Dispose of the needle and syringe in the sharps container without recapping. 9. Final patient care. Apply gentle pressure to the puncture site using a gauze pad. Once bleeding stops, secure a bandage over the site. Observe the patient for any adverse reactions. These steps, when followed meticulously, ensure a safe and comfortable experience for the patient while minimizing the risk of complications.